Welcome into Arthrex's annual Team Physician Controversies meeting, also known as TPC. I'm Stephania Bell, ESPN's injury analyst and physical therapist, and I want you to join me as we meet some of the expert faculty who are here in attendance. I'm happy to be joined now by Dr. Bob Anderson, renowned foot and ankle specialist with Ortho Carolina and associate team physician for the Green Bay Packers. Thanks for joining me, Bob.
Thank you, Stephania. Great to see you.
So, treetop view, what are some of the reasons that Achilles tendon ruptures are so devastating for elite athletes?
Well, obviously your Achilles tendon gives you all your push-off, your explosion. And if an elite athlete doesn't have a good Achilles with that tension properly set, he's just not going to get the same performance that he needs to function at a high level.
So when it comes to repairing these types of injuries, what are the benefits of a minimally invasive repair using the PARS system?
So no matter how you're fixing the Achilles tendon rupture, you're trying to restore the tension. But we want to be able to do that with the least number of complications. The idea of the PARS, the mini open technique, is you're decreasing the risk of infection or wound healing problems. What we also found over years doing a lot of research on the Achilles tendon, the use of the PARS technique, is that basically the athletes get back quicker because you're preserving all the circulation around the native tendon.
Athletes always want to come back to play quicker. What have you heard from them about how the repair has performed since using this PARS system?
A lot of times they'll go in, their buddies will go, "You don't have an Achilles tendon rupture, I don't see a scar." And so they love it because it's simple, it's easy, it's quick to recover from, less incisions to heal. So they find that it's just an easier process. It's still a long recovery, but the overall outcome's been very, very good.